This week, I have the pleasure of sitting down and talking with someone who has been board certified for over 40 years in internal medicine. He maintains a practice in Palm Desert, California. He's devoted to wellness and a preventative approach to illness. He is known nationally and internationally for his innovative approach to natural hormone replacement. This week, I'm excited to introduce to you guys the author of Adrenaline Dominance, and we sat down and talk all about adrenaline dominance. What does adrenaline do for our bodies? What type of symptoms do we have when we have too much adrenaline? And what can be done to help us with controlling the adrenaline? Have you guys heard of ADHD? I'm sure you have. What about anxiety, PMS, alcoholism, road rage? What about depression? And of course, we all know insomnia. There's so much more that he's going to share with us. You don't want to miss this show. Please welcome Dr. Michael Platt to Authentic Talks. Authentic Talks is all about authentic conversations. This show is all about growth, love, respect, success, mind, body, and spirit. If you're looking to grow and become your authentic self, then this is the podcast for you. And I am your host, Shantae. Welcome to the show. Hi, how are you?
I'm good, thank you.
That's good. I'm glad to hear that. I'm really excited to have you here today because there's so many things that I want to talk about with you.
It's a big subject.
Yes, it absolutely is. Before we move forward, can you share with our audience just a little bit about you?
I was born and raised in New York City, went to medical school in New York, became board certified in internal medicine. I've mostly dealt with what's called the cause of illness, and which is something that doctors are not trained about to do about the causation of illness. And I got very interested in hormones after my mother died. She died of breast cancer, and I realized right after she died that I had inherited her hormones. Most people do not realize that men and women have the identical hormone. I'm known mostly for about specializing in bioidentical hormones. You know, saying that after my mother died, and she died of breast cancer, which meant she had problems with too much estrogen and too little progesterone. And I figured that I had inherited her low progesterone, and she also a large abdomen. She was thin everywhere else, and the only thing that'll do that is too much insulin. And I assumed that her low progesterone also affected her insulin levels. And I know that in those days, every time I was driving, I used to have to slap my face trying to keep my eyes open. Well, anyway, I started using progesterone, and right after I started using it, I never got sleepy again in a car. So even though there's no literature to say that progesterone blocks insulin, I know that it does. And, you know, the whole thing about estrogen, you know, it's my least favorite hormone. And people don't realize it's actually a very toxic hormone. You know, when women complain about cramps and PMS and breast tenderness, you know, that's estrogen. And it causes things like fibroids and endometriosis and polycystic ovaries, and causes gallbladder disease and asthma and migraine headaches and phlebitis and blood clots and 6 different cancers. And, you know, and what protects women from estrogen is progesterone. And that happens to be my favorite. So, and we'll be talking about that. So
Wow.
in any event, yeah, but so I wrote a book called The Miracle of Bioidentical Hormones, and that literally brought thousands of patients to my office from all over the country and all over the world. And I had the luxury, if you will, of being able to sit down and talk to them for about 2 hours, you know, each of my patients. And the whole thing about diagnosing people and treating people is that 90% of the diagnosis is sitting down talking to a patient. And unfortunately, doctors don't do that. You know, they look at lab tests and they treat symptoms. But so I got to know people fairly well in terms of putting their symptoms together with their hormones. And I became very interested in adrenaline. And that's what we're going to be talking about today. And adrenaline is a hormone that most people have heard about. You know, they call it the fight or flight hormone. Adrenaline is not only a hormone, it's a neurotransmitter that affects a lot of activities in the brain.
What is the name of your book? Is it the Adrenaline Dominance?
Yeah, that's exactly what it's named. I sort of borrowed, you know, John Lee wrote a book called Estrogen Dominance, or he was known for estrogen dominance. So this is another hormone in excess that creates problems, and I called it adrenaline dominance.
Adrenaline dominance, a revolutionary approach to wellness.
It's a hormone that's completely off the radar of the whole medical system. Even though it's responsible for a lot of conditions, and we'll talk about those. Doctors cannot really, even though you have what are called functional medicine doctors, you can't be a functional medicine doctor without really understanding adrenaline and what it does.
How is your work groundbreaking?
Well, it's just that there are a lot of conditions that are associated with excess adrenaline. For example, there are a lot of people that have trouble sleeping. And the number one reason why people have trouble staying asleep or even falling asleep is excess adrenaline. Some people toss and turn. Some people grind their teeth at night. Some people have what's called restless leg syndrome. Some people get up at night to urinate. This is all adrenaline. And
adrenaline, are you saying like where my heart is beating fast?
That's exactly what I'm talking about. The same hormone that causes, palpitations and rapid heartbeats and makes the blood pressure go up and causes a lot of tension in the back of the neck. And when people have cold hands and cold feet, that's adrenaline, not a low thyroid. And, when people have a lot of adrenaline, they carry a lot of tension in the back of their neck. It makes the mind go very quickly. And, you may have heard of a condition called ADHD.
Yes.
Attention. And ADHD is all about adrenaline. And my book is the only book that ever talks about adrenaline and ADHD, even though there are 1,000 books out there on ADHD. And what's interesting, why it's so important to understand excess adrenaline is that you can actually eliminate ADHD in 24 hours. Just by lowering adrenaline. They have literally millions of children on these drugs, things like Ritalin, Strattera, Adderall. And one of the side effects of these drugs is actually sudden death. Because, here you have children that have a lot of adrenaline, which makes the mind go very quickly so they can't focus because they get distracted very easily. And all these drugs actually increase their adrenaline level, which numbs their brain. So they're treating these conditions with the same hormone that creates it in the first place. And needless to say, if a child doesn't have ADHD, these drugs give it to them.
I want to go back a little bit. Can you share with me how your approach to wellness is different from other wellness experts?
Well, I have an advantage. And the advantage that I have is that I understand basically how the body operates. And when you understand the body from that standpoint, you can approach their conditions from a different direction. For example, let's say you have somebody that has anger issues, road rage. Well, the only cause of road rage is excess adrenaline. So by lowering adrenaline, and we'll talk about that, by lowering adrenaline, you can get rid of road rage in 24 hours. People go to anger management class, which is a waste of time because they don't deal with why people have anger issues and they don't deal with how to reduce anger. And it's the same thing with ADHD. They have all sorts of drugs for it. These children and their parents have been told that they have what they call a learning disorder. Well, ADHD is not a learning disorder. It's an interest disorder. In other words, if these children are interested in something, they'll focus. If they're not interested, their mind goes so quickly that they get distracted very easily. So ADHD is not a learning disorder. It's an interest disorder. And again, when people watch television, they might see an advertisement for what they call an overactive bladder in women. Women that have to run to the bathroom. And some women, as they're running to the bathroom, they get leakage, and that which is actually called urgency incontinence. But again, this is all caused by excess adrenaline. And, there are women that are getting Botox injections in the bladder, which means that for the next 3 months, they have to catheterize themselves every time they have to urinate. I don't think they tell them this, but that's what happens. So
are you saying that causes them extra adrenaline as well when they get that shot?
No, they get the shot to numb the bladder, but if they reduce adrenaline, then all that what they call an overactive bladder that goes away. You may have heard of a condition called fibromyalgia. And there are about 10 million people in this country with fibromyalgia, and basically every one of them have been told that there's no cure for it. And yet that's not true because it's because they don't understand what causes fibromyalgia. In fact, a lot of doctors don't even think it exists. But the pain of fibromyalgia, just due to a buildup of lactic acid in the muscle tissue. And these are people that have a lot of adrenaline. And because remember, adrenaline is what they call the fight or flight hormone. So these are people that keep their muscle tense, 24 hours a day. And the muscles are so tense that they cut off the circulation going through the muscles in the venules and little veins, and also in the lymphatic circulation, which normally carries lactic acid out of the muscles. But that acid just sits there. So just by reducing adrenaline, now the circulation can go right through the muscles and clear out the acid. So you can get rid of fibromyalgia in as little as 3 days. Well, let's start from the beginning when excess adrenaline first becomes apparent. Are you familiar with something called colic in babies?
Yes, I am.
And that's excess adrenaline. And you can actually eliminate colic in a baby in about 3 minutes just by applying progesterone cream to the abdomen or the belly of the baby. What's interesting is that colic in babies has the same cause as what they call postpartum depression in women. Women that get depressed after they deliver, because they're both caused by that drop in progesterone. And babies are affected by getting colic, and women are, the mothers are affected by getting depression. And they're both treated the same way with progesterone. And then the next time, you may have heard of something called the terrible twos, and that's adrenaline. But there's something called bedwetting in children, which can be devastating for some of these kids, and they can deal with it for years. But actually, by lowering adrenaline, you can get rid of bedwetting in 24 hours. And then the next time that adrenaline becomes apparent is, again, with children with ADHD. But then, there are other conditions like irritable bowel syndrome, which is all about adrenaline, and people that have, I mentioned anger issues and road rage. And right now we're dealing with the coronavirus, which is causing a lot of stress and anxiety in people. And anxiety and stress are all about adrenaline. And the problem is that when people have a lot of stress and anxiety, the body puts out cortisol to deal with adrenaline, to help with anxiety and stress. And the problem with cortisol, it's very damaging to the immune system. So again, just by lowering adrenaline, you can help with your immune system and help prevent the ravages of the coronavirus. So again, lowering adrenaline is helpful from that standpoint. Bipolar disorders, and there's a condition called PMDD, which is premenstrual dysphoric disorder. It's found in about 5 to 8% of women. And these are the women that nobody can live with for about 10 days out of the month because they have severe anger issues and severe mood changes. And again, it's another condition that's felt to be incurable because they don't know what causes it. But again, it's excess adrenaline and very easy to eliminate.
If someone was to buy your book that was listening to the show right now, would it be possible for them as readers to come away from your book with self-help tools so that they can make adjustments on their own? Or do they need to be under the care of a physician?
My books are written so people do not have to be under the care of a physician. Frankly, doctors not only are not trained to treat the cause of illness, they get very little training in hormones, even though hormones control every system in the body. So yes, people can read my book and they'll know exactly what they need to do to lower adrenaline. And they will not have to rely on a physician, because even the progesterone cream, which is that I mentioned, it's a 5% strength. It's the exact strength they need to block adrenaline. And that's available over the counter. They don't need a prescription for it.
If someone followed the advice in your book, how long would it take for them to notice the effects of it?
It all depends on how much adrenaline they have. People that are very anxious, they'll know within minutes, be much more relaxed, and they'll be able to focus a lot better. So it all depends on the kind of symptoms that they have. Within 24 hours, they'll be sleeping through the night and gets rid of road rage in 24 hours. So it all depends on how they adhere to the protocol in the book. Again, it all comes down to treating the cause of illness. And when we're talking about adrenaline, what makes it relatively simple, there's only 2 reasons why the body releases adrenaline. One is if somebody's in danger. Remember, it's a fight or flight hormone. But most people do not live in a war zone, so they don't have excess adrenaline because of danger. So the only other reason why the body puts out adrenaline is to raise sugar levels for the brain. See, most people do not realize, including doctors, that the brain uses more sugar than any other part of the body. And when you take sugar away from the brain, people get sleepy. They call that hypoglycemia, low blood sugar. And that's why people can get sleepy in the afternoon when insulin peaks, or a lot of people get sleepy when they're in a car, either as a driver or as a passenger. Again, it's a low blood sugar. But anytime the body detects that there's a low blood sugar, it simply puts out adrenaline to raise sugar levels. So the primary function of adrenaline is to make sure the brain has fuel. So if you understand this, and what you do, you just have to make sure that the brain has the fuel that it requires, so that the body doesn't have to use adrenaline to raise sugar levels. It's relatively that simple.
Why is awareness of the role adrenaline plays in our lives becoming more and more newsworthy?
Well, it's always been newsworthy. It's just been unnoticed. You know, right now, my book is the only book that has ever been written that talks about adrenaline and the clinical consequences. When people say to me, why is that? I don't have an answer for them. You know, but you have to remember that most of what doctors learn is based on studies done by drug companies. And drug companies are only interested in creating drugs that they can sell. And they can't, they can't patent natural products. So they have no interest. They have a lot of drugs that people take because of excess adrenaline. They have antidepressants and anti-anxiety agents. They have pain medications for fibromyalgia. I mean, they have a lot of drugs related to excess adrenaline, but there's nothing that they will sell to get people well again. Because we have a medical system, and if you don't mind my venting for a little bit, that thrives on disease and illness. It does not thrive on wellness. And, right now, prescription drugs are the third leading cause of death. And frankly, that's another way of saying that doctors are the third leading cause of death. I mean, you don't hear this, this is basically, you mentioned before, medicine is a passion for me, and it is. And I'll be honest, I've gotten in trouble because, with the medical board because of my passion, because I refuse to stop taking people off drugs.
When you were younger and you were like feeling this passion for going to medical school, I don't know when that kicked in for you. Some people say it's like as high school, middle school age. That's when they know. But that's why you joined, isn't it?
Most doctors have ADHD. In fact, I could almost say that all doctors have ADHD. And I had classic ADHD. I never opened a book in high school or college until the night before an exam. But it wasn't until I got into medical school that I started studying. Because I was interested in medicine. You're absolutely right. And but there was nothing in high school or college I had any interest in. And that's the whole thing about ADHD, what I mentioned before. It's not a learning disorder, it's an interest disorder. And but I, like I mentioned, I do have a passion for medicine. And getting people well, it's extremely rewarding. And unfortunately, doctors don't see enough of it. We won't get into my feeling about drugs, but
why is it that we never hear from doctors about adrenaline?
That's an excellent question. And that, like I say, I don't have the answer for you but doctors, like I say, everything doctors learn in medical school is based on research done by drug companies. And drug companies are not interested in the causation of illness. They're just interested in treating illness. So it could be that's the reason why nobody has looked at adrenaline and all the, conditions that it causes. We've touched on some of them. There are a number of other ones, but, they literally had millions of children that are like 2 and 3 years old that are on psychoactive drugs. I mean, this is ridiculous. I'm just saying.
Have you ever tried to challenge the healthcare system?
Well, my books have challenged. The first book I wrote, The Miracle of Bioidentical Hormones, the experts of the medical board felt that the ideas in that book were so dangerous I shouldn't be practicing medicine. And,
Wow.
and all the book talks about is treating the underlying cause of illness and getting people off drugs. When you get hormones in balance, hormones control everything. And doctors are not trained about hormones. So they went after me. I have to be honest with you. They went after me because I was taking people off drugs. They never had a complaint from a patient, but they had a complaint from doctors because I was taking their patients off their drugs. And the medical boards are funded by drug companies. So yeah, they had an interest in me. Dig it. But I've never changed the way I approach patients. So, that's one of the reasons I wrote the book, because people cannot rely on a medical system that has no interest in keeping them healthy.
What do you think can be done to turn the medical community around and treat the cause instead of the symptoms? Because it's about money. What do you think they can do to get back to the people?
Well, I mean, you're right about that. The medical system, it's a multi-trillion-dollar year industry. And like I say, it thrives on disease and illness. It does not thrive on wellness. So what's going to turn it around is if people get angry. Right now, people go to see their doctor and they expect to get a drug. And they're not happy unless they, but and doctors think they're helping people by putting them on these drugs. statin drugs, that cause brain damage and memory loss and permanent nerve damage and irreversible kidney failure and 50% incidence of diabetes, and they cause, heart damage and sudden death. And these are the largest selling drugs in the world. And yet people with the highest cholesterols have the greatest longevity. People, they try to get their cholesterol level below 200, which was the artificial level created by drug companies, not by doctors. Drug companies that decided. And because when I did my training, a normal cholesterol was 300, and they have much less heart disease then.
Wow.
But when they came out with the statin drugs, they couldn't get enough people on the drugs. We should be thankful because they actually got the normal level down to 160 because they wanted to put children on these drugs. And
wow.
But smarter kids prevailed and went back up to 200. But so I got in trouble for taking people off statin drugs. All doctors take what's called a Hippocratic oath, when they finish medical school. And it's one of those do no harm type things. And, I surrendered my license because I just couldn't deal with the medical board anymore. And yet for me to tell a patient to get off a statin drug is against the law. I can't do that. What law do I, and that's California that's saying this. Do I listen to that, or the fact that I have an MD and took a Hippocratic oath? I mean, or should I stick to my oath and try to get people off these drugs? I don't know.
Well, I think it's probably definitely stick to your oath and get the people off the drugs.
Okay, as an example.
Get the people off the drugs. The drugs is the thing that's causing, like you said, the problem.
Well, I've had patients that have been on 15, actually even more than 15 drugs at one time. And I once had a pastor. Pastors are very creative type people. They're almost like Hollywood movie stars. They like to give these impassioned talks and stuff. And people that are creative actually have the most adrenaline. And he was on 15 different drugs, and his congregation thought he had Alzheimer's because his voice was sluggish because of all these drugs. So I took him off all 15 drugs. And his congregation thought that there was a miracle, because he changed so much.
Wow.
So I said to him, do you realize that Jesus is getting all the credit for what I did for you? And he looked at me and he said, Jesus sent me to you. So,
so Jesus got the credit anyway.
Well.
Wow, I have to be honest with you. This is the first time that I'm hearing about this.
That's because we never talked before.
Right. I want to back up a little bit. You said that you relinquished your license?
I surrendered my license. I spent $500,000 trying to fight the medical board. You can't beat, and like I said, never harmed a patient, but they went after me more aggressively than any other doctor ever in California.
Wow. It reminds me of a story that I had heard some time ago about another doctor. They call him Dr. Sebi. And I know he had to go in front of Congress. And it feels like what I'm noticing is that, I say you should definitely keep following your heart. I love your book. I'm glad that you wrote it. I would recommend to every single person tuning in today to get this book. I feel like when it comes to things that are going to help us save our life, or to have a better understanding about how our bodies work, I think that definitely this is a book that every single person should have in their home. Everybody should have it.
You're now officially in charge of my marketing.
It's true though. They really definitely should.
Okay.
So even though the U.S. spends more money on healthcare than many other developed countries, why do you think we still have the highest incidence of diabetes, obesity, heart attacks, cancer, and infant mortality?
Well, the point there is that even though we do spend more money than any other civilized country, and obviously there's something wrong with our healthcare system. And because it's all trained on drugs rather than treating the cause of illness. Other countries, it's becoming so apparent with this coronavirus type thing, where people in other countries, when they get sick, they actually, have been going to the hospitals, because they don't have to pay anything. But here, there are a lot of people that are avoiding going to the emergency rooms because they're afraid of catching something in the emergency rooms. And then there's the cost of going into an emergency room now and getting hospitalized. And what do we have, 20, 30 million people that have no health care, no insurance. And we also have the highest incidence of infant mortality. You would think we were a third, what do they call it, third something country?
They call it our third world country.
Yeah.
Is what they refer.
Yeah, we don't have a good medical system, and that's because drug companies control our medical system. They have something called evidence-based medicine, and that's what doctors believe in. But evidence-based medicine is what drug companies, it's all the studies that they do, and they have complete control over these studies. And even if they get a bad result, nobody ever knows about it because they have control over these studies. And that's why I said before that drugs are the third leading cause of death. Some people feel it's more than that, but drugs are fairly toxic, and it just makes more sense to me to treat the cause of illness. Look at all the people that have high blood pressure. Well, adrenaline is one of the hormones that raise blood pressure, and when people have a lot of adrenaline, it raises sugar levels. Then the body puts out insulin to deal with the sugar, and insulin also is a hormone that raises blood pressure.
I have a lot of adrenaline.
I'm sure you're a creative type person.
When I was younger, I could not control it. If someone would offend me, or I had a hard time really communicating with them to say, hey, wait a minute, you're disrespecting me. That's offensive. Instead, my heart would be fast and I would just sit there and look at them while they were doing whatever they wanted that I didn't agree with. And my heart rate would tell me, you're not happy about this.
Interesting. And while we're talking about you, and let me tell you about creative type people. And I mentioned that they had the most adrenaline. Creative people are very intuitive about other people. In other words, you can pick up good energy and bad energy from people.
Absolutely.
And creative people are the ones that have premonitions and deja vu type feelings. And when the phone rings, you'll either know who it is before you answer, or you'll say, I was just thinking about you. And you'll notice that animals and small children will be very attracted to you. And you actually have the same ability as a clairvoyant or a psychic, because when people are right brain, which means creative, and they have a lot of adrenaline, the adrenaline in your right brain allows you to tap into the energy that goes through the air. A lot of energy going through the air from cell phones and Wi-Fi and satellite and even garage door openers. And because you can tap into that energy, that's why you're very intuitive about people and have premonitions. And also animals are very attracted to that energy that you have. That's how dog whisperers and horse whisperers operate. And this is all attributable to adrenaline. And so I just want you to know that. You mind if I ask if you have any children?
I do have children.
Okay, well, hormones run in families. So if you have excess adrenaline, they have excess adrenaline. I just want to let you know that.
Wow, thank you for sharing that.
I'm
welcome. Actually going to have to look at things like from a different perspective. I'm very open-minded. I have an open mind.
Well, that's good.
I really appreciate you sharing. I feel like we could talk all night, but I know we don't have all night. How did you figure out that this is a solution?
Well, I sort of alluded to it. I mentioned that I've always had the advantage of spending a lot of time with patients. And like I say, I used to spend 2 hours with each new patient. And when you talk to them and you find out about their family life and their problems and their conditions and their issues, you can start putting things together and you start seeing a pattern. A lot of people have trouble, sleeping, and then these are the same people that had ADHD, and these are the same people that have anger issues and anxiety. So in other words, you start putting things together. The main thing that you want to do is to let these people know how easy it is to get better. If they want to get better. It's funny, even when it comes to the hormone progesterone, which is my favorite hormone, 99% of doctors think it's a woman's hormone. And they don't realize that men and women have the identical hormones. It's not a woman's hormone. Men also produce progesterone. They stop producing it around the age of 50. And because progesterone blocks insulin, once their progesterone level goes down, they start putting on weight around the middle because that's where insulin puts on fat. And then they start getting prostate cancer after the age of 50 because prostate blocks estrogen. It prevents, 6 different cancers in women, and it prevents prostate cancer in men. But once they stop making it, then men start getting, so it's an important hormone for men also. And yet doctors think it's a woman's hormone. They never prescribe it for men. It's not hard to get people well. You just have to treat the reason why they're not well. And, it sounds, fairly logical, but that's the way it is.
Wow, I love that. I agree.
But as I said before, medicine is a passion for me. And I enjoy getting people well and hearing about people getting better. Another hormone that's overlooked or underlooked is thyroid. Thyroid controls metabolism of every cell of the body. It's an extremely important hormone. And yet doctors don't know the right test to order. They don't know how to interpret the test. They don't know how to prescribe thyroid. Like I say, it's not a perfect world out there when it comes to the medical system. And just about everybody who's got a lot of adrenaline is going to have an underactive thyroid, because when people have a lot of adrenaline, it creates stress, and the body's putting out cortisol to deal with the stress. Cortisol is an anti-thyroid hormone. So it's just a matter of putting one thing together. But once you understand hormones, you can get people fairly well.
Wow, that's good stuff. That is really good stuff. So if someone wanted to pick up your book, how would they do that?
Yeah, well, the easiest, it's on Amazon, both as an ebook, as a regular book, and it's on my website, www.plattwellness.com. I should let your listeners know that I think we're going to have a special coupon for your listeners. They'll get a special price or deal on something.
Oh, that's nice. I will definitely have to put that in the show notes. And
if they call my office, I'm there in the afternoons. I'm usually very often the one that answers the phone. And or if they can call anytime and leave a message. I will return their message.
Okay.
And if they're interested in the phone number, it's 760-836-3232. And we're located in Palm Desert, California, which is near Palm Springs.
All right.
They can ask questions, because the people are looking for answers, and I enjoy talking about medicine. So.
Yeah, I can tell. Yes, that you're very passionate about it. And we need people like you. We do, to spread this message and to make people aware of other options.
Mm-hmm. There are some people out there that are concerned about weight. Did you know that? Some people concerned about weight?
Yes, I'm one of them, and I know several people that are.
What probably your listeners might find interesting, the number one cause of weight gain is excess adrenaline, the number one cause. And you're going to say, well, how can that possibly be? How can adrenaline cause weight gain?
Hey, you must be psychic.
Well, it just... The thing about adrenaline, remember that the reason why the body is releasing it is to raise sugar levels for the brain. And when it comes to sugar, it doesn't matter whether people are eating sugar or if the body's making sugar. If you don't burn it up, then the body takes that sugar and stores it in your fat cells as fat. Now, adrenaline peaks at 2:30 in the morning, and a lot of people get up at that time to urinate or just wake up. And when the body releases adrenaline, it creates stress to the body. And again, when the body is under stress, the body puts out cortisol to deal with the stress. And the first thing cortisol does, it also raises sugar levels to deal with the stress. So now while people are lying in bed, sleeping or trying to sleep, they're putting out 2 hormones that raise sugar, and they're not burning it up because they're just lying there. And it is absolutely the number one cause of weight gain, and nobody talks about this. People have heard that cortisol can cause weight gain, but they don't understand that it's adrenaline that causes the release of cortisol. And let me repeat, cortisol is very damaging to the immune system. So now is not a time when people want to be putting out a lot of adrenaline, which is raising cortisol levels, because they have to rely on their immune system. They talk about, the elderly are the ones that have the most
vulnerable,
but, you hear about young people that are dying from COVID-19. And, obviously it's all related to the immune system. So, and everybody, we don't need to talk about it, but, vitamin D, people are talking now about the flu season that'll be coming up in a few months. You've heard people talk about flu shots. Well, flu shots don't really prevent the flu. In fact, very often they causes the flu, but they have something that people can do that 100% of the time will prevent the flu, 100%. And that's a high dose of vitamin D. But, they tell people sometimes to go out in the sun. Well, probably 20 years ago, we stopped converting sunlight into vitamin D. We don't convert sunlight into vitamin D. So going out in the sun does absolutely nothing.
Does nothing?
Does nothing. It probably does other things, but it does not raise vitamin D level. But the sun doesn't hurt. Taking 10,000 units of vitamin D will prevent every flu there is. And yet the recommended daily allowance of vitamin D is 400 units. And here I'm talking about 10,000 units. But in the old days, when we could go out in the sun and convert sunlight into vitamin D, 10 minutes of sunshine provided 10,000 units of vitamin D. So why are they recommending 400 units? Do you think maybe because they want people to get sick? Think about it. Because, it's a medical system run by drug companies. Of course they want people to get sick.
I think that we're all thinking about it. And we're like, you're onto something.
Well, and 10,000 units of vitamin D prevents 26 different cancers, including breast cancer, prevents Alzheimer's. And 10,000 units, people that are on that 10,000 units of vitamin D will never get a sunburn. And it prevents skin cancer at the same time. But I should caution, if you're going to get vitamin D, do not get a gel cap. And supplement makers should listen to this because the oil in gel caps prevent the absorption of vitamin D. They don't block it completely, but they'll cut it down at least by 50%.
How would people be able to start getting that vitamin D if they...
In a capsule with powder, and they need to take vitamin K2 along with it to prevent vitamin D from putting calcium into blood vessels.
I don't even think they prescribe.
They do. They come together.
Oh, okay.
Yeah, doctors don't get training in supplements either. They get training in drugs, but they don't learn the side effects of drugs.
Wow, you had such a passion that you decided to go above and beyond and to truly walk in.
Well, like I said, I enjoy medicine, but it did get me in trouble. Not with patients, but with the medical board.
And you never harmed a patient.
I've never harmed a patient. They have never had a complaint on me from a patient.
Can we talk about that a little bit more? The medical review board in California felt what?
Well, they had complaints from doctors that I was taking their patients off medications. So, and remember that the medical boards are funded by drug companies. So this, was eye-opening to them. They have a doctor taking people off drugs. So they could not investigate me because they never had a complaint from a patient, and they needed 3 complaints to investigate me. So they sent in undercover patients to, just so they could initiate complaints, so they could, go after me. And that's what they did. And they made up things and lied and this, that, whatever. But I'm just saying that. But that's the medical board.
So basically, once you become a doctor, you have the opportunity to make so much more money if you prescribe medications to patients that maybe they don't need versus healing them.
I could understand doctors doing that to make more money, but I think doctors and drugs, I think more because they don't know, more like ignorance rather than, because they do not know how the body operates. They don't know the cause of illness. So all they know is they've been trained to give out drugs. If you have a problem, take a drug for it. If you have diabetes, you take a drug to lower blood sugar. If you have high blood pressure, you take a drug to, it's just whatever. But trying to figure out why somebody has a problem, that takes thinking. I don't know, maybe they don't have time to think or the capacity to learn.
You know what? I definitely appreciate you coming on the show today. It's been awesome talking with you, and I appreciate your knowledge that you shared. I'm going to be honest with you. I don't have too much pride to admit that I learned something new today. I learned something new, and I love it.
Oh, okay. Well, but, and I'm always available if you have any question about you or your children, because like I said, they're going to have a lot of adrenaline also. Well, people get into drugs and alcohol when they have a lot of adrenaline because they're just trying to relax. It's the number one cause of addiction. And, when people go into rehab, they don't deal with why they get into drugs in the first place. They just get them off their drugs and send them away. A lot of that is because they're looking for repeat customers. I mean, that's how they make money. Now, I mentioned that creative people had the most adrenaline. And if you look at the music industry and the amount of drugs and alcohol in the music industry and the amount of overdoses and in Hollywood, and, so creative people, are the ones that have the most adrenaline. And nobody talks about this. We talked about fibromyalgia. Lady Gaga has a terrible case of fibromyalgia. If you run into her, tell her to call me.
You know what? I'm going to put this on YouTube and I'm going to see if I can get some help with making it go viral.
Okay, well,
And maybe it'll get to her. I find it really interesting what you're saying. I've always been a person that I remember from a young person of having like the adrenaline, and I knew it because I could hear my heart rate beating in my ears. I was very blessed because I was sheltered, so I didn't go down the path of like drugs. And I do drink though. I love wine,
well,
you know, but
well, just to relax. Yeah,
not every single day.
I
And,
understand.
yeah. And so I love this conversation that we had. I really want to say thank you so much for coming on the show and
Can I say one more
sharing.
thing?
Absolutely.
I should mention that progesterone cream, and and what people will learn if they're is about the 5%. That's the magic strength. That's the strength you need to block adrenaline. Progesterone is wonderful for dogs. Dogs that have what's called separation anxiety, and dogs that are aggressive, and dogs that have asthma. It goes inside the ear because it's like skin inside the ear, and it goes to work right away.
Wait, I'm sorry. Dogs have asthma?
Yeah, well, dogs get just about all the same problems that we do. They have
Oh, wow.
seizure disorders. Some are afraid of thunder, but they have hormones just like we have hormones, and you have to remember they all get fixed. They get spayed or altered or castrated, so they have hormone issues just like we do, probably more or at least as many. So progesterone is wonderful for dogs.
Wow, that's awesome. That's so awesome to know.
You've heard of people that have migraine headaches?
Yes, I know several people that have them.
Okay, I can almost guarantee that they're not migraine headaches. There's another type of headache called occipital neuritis. It comes from the occipital nerve sheath at the back of the skull, and it very often shoots right into the back of the eye. It causes excruciating headaches. They're always mistaken for migraines, but these headaches are easy to prevent and easy to eliminate because they're caused by adrenaline. And just by putting the cream on the back of the neck eliminates these kind of headaches. And they're a lot more common than migraine headaches. In fact, I would say 98% of people that complain about migraine headaches have this type of headache, and nobody ever talks about it. Again, let me repeat, it's called occipital neuritis. And people can actually diagnose it themselves just by taking their thumb and pressing it in at the base of the skull upon a very tender spot. And you may have heard of people that complain about ringing in the ears. They call that tinnitus. And the most common cause of that is also adrenaline, by causing the muscle to tense up in the neck. It cuts off the circulation to the inner ear. I'm just mentioning these things because, it's not hard to get people well. You just have to treat the reason why they're not.
That's awesome. I really do appreciate you sharing that information with us.
You may find yourself that you carry tension in the back of your neck.
Yeah, I do from time to time.
Just that when people have a lot of adrenaline, it's a commonplace that shows up.
I have to get comfortable. I just thought that it was because my head was heavy.
Well, that too. Okay.
And so sometimes I just try to prop the pillows a certain way. Wow, you guys, I really enjoyed talking with Dr. Platt. We received a lot of information. I really appreciate this book that I have in my hand called Adrenaline Dominance, and it says it's a revolutionary approach to wellness. I am definitely down with finding alternative medicines and finding solutions that can help us versus tearing up our bodies. So I'm definitely pro adrenaline dominance. Okay, I also have the cream here, you guys. It's 3 ounces and it's called Platt Pro 5%, and it's with the lavender essential oil. It does work. I do get tension in my neck from time to time, and the cream does work. It doesn't have a very smelly odor to it like most products have, like the Bengay type smell. It doesn't have that. It does have lavender in it. And I'm really excited about talking with Dr. Platt. I hope you guys were able to get quite a bit out of the show. I learned today that ADHD, anxiety, depression, road rage, irritable bowel syndrome, autism, bedwetting in children. He also mentioned weight gain. There was just so many different things that he mentioned. He talked about bipolar disorder, the restless leg syndrome. And if you guys have questions or want to know additional information, please feel free to reach out to Dr. Platt. He did leave his information in the show. And if there's a part of the show that you want to hear again because you missed it, go ahead and just rewind and fast forward through to get to that part that you're interested in hearing. There's so much more in the book. We were only able to talk about so many of the symptoms that you get when you have too much adrenaline. So pick up the book. You guys will be able to find out so much more. I hope that you all are doing well and everyone is being safe. Thank you guys so much for tuning in. My name is Shantae with Authentic Talks. Thank you so much for coming on.
It's been a pleasure. It really has.